Okay, hi everyone, and welcome to our webinar today with the Clinician Engineer Hub, bridging the gap between medicine and engineering. And we always have fantastic speakers as part of our webinar series. I'm really excited to introduce Joseph Smith here, who is a business development expert for the innovative company Cauli. Now, when I was walking through Addenbrooke's Hospital, I came across this organization focusing on the issue of packaging waste and really trying to do something innovative around this concern. This is a huge issue, particularly in healthcare, but also within other organizations. So, Joseph, fantastic to have you here today. How are you doing?
Not too bad, Neil. Yeah, thank you very much for having me on.
Great to have you. So, really excited to learn about your background, how you got into this space, the various efforts that you and your company are doing, particularly in healthcare, but also in the wider remit. Because I think just looking at it from my perspective as a hybrid clinician engineer, the technology really was interesting to me. I was drawn towards it, particularly not only for the issue that you're trying to solve, but the simplicity. But I won't take it away from you. So over to you, Joseph.
Yeah, I'll give you a very brief background on myself. Yeah, I'm originally from London, but actually spent the majority of the last 5 years actually based in Amsterdam in the Netherlands. Originally studying a master's degree in environmental geography, and then working in various kind of ESG-based roles around there. The Netherlands, obviously, a very innovative kind of startup hub. Lots of great things going on there. But I actually relocated back to the UK and found this role in business development over here at Cauli, where I just joined relatively recently at the start of the year, but have been kind of thrown in at the deep end, really, in terms of just getting really my hands dirty with, especially within our business development across the healthcare sector. Yeah, I'll give you just a little bit of background about, yeah, Cauli as an organization. So yeah, we were founded in 2019 with kind of one sole aim, which was to eliminate single-use packaging waste from the food service sector. And as of 2025, we're currently the UK's largest tech-enabled solution for the food service industry. We're active in, I think it's just over 50 sites across the UK, which now includes 14 NHS hospitals, one of which is obviously Addenbrooke's, where you came across our solution. But yeah, it is definitely something that I'm quite passionate about, given my academic background, and yeah, really excited to kind of continue moving forward and progress my career in this space.
Definitely. No, it's very interesting. I have lots of questions because I'm very naive in many aspects. I'm going to go all the way back to what you said at the start. So, love the fact that you have an international background, and that experience, I think, really, I know from myself, having done the same, not based in Netherlands, but other parts, it really gives you a perspective. How does the landscape, would you say, innovation-wise in the Netherlands? Is there any similarities to the UK? What could we learn from what they're doing, just generally in innovation? Anything that potentially the Netherlands could learn from us within the United Kingdom?
I think the Netherlands, especially Amsterdam specifically, is that's the kind of place that I've got the most experience. Is very like a startup conducive space in terms of the kind of funding they get, but also in terms of the fact that it's a city that's sort of very small geographically, but with quite a large international reputation. I think, especially since Brexit, I think quite a lot of international businesses have moved from the UK over to the Netherlands, not just because, well, number one, because like, obviously a lot of Brexit complications with regards to the actual business and make it an international business, but also due to the fact that I think the Netherlands is statistically the nation outside of English-speaking countries with the highest percentage of English speakers. So it's a very popular international business in that regard as well. It's a very kind of like multicultural place, big melting pot of cultures, which obviously we do have over here in the UK as well.
Okay, well, yeah. I think
Yeah.
you raise a lot of interesting points, particularly around the Brexit scenario, and obviously language is crucial.
Mm.
What about regulation? Everyone panics around regulation. So I know in the UK, if we're trying to be forward thinking with novel products, devices, diagnostics, let's say, we have various hoops to jump through. Would you say from your experience, the Netherlands is similar in terms of regulation? Are they able to fast track aspects of the regulatory process?
I'd say the Netherlands is slightly ahead of the UK in terms of regulation regarding kind of eliminating single-use packaging and trying to really bring reuse into kind of the forefront of waste management solutions. Although I wouldn't say it's too far ahead of, not well, the UK overall, but Scotland definitely acting relatively independently in terms of really trying to kind of tighten the screw and make reuse like the kind of number one solution that we can see that looks kind of accessible, not just across like the healthcare, but specifically I've had quite a few interesting conversations with people working in higher education at Scottish universities and Scottish colleges. And it's definitely something that, whilst the Netherlands, I think, is slightly ahead, similar with a lot of Scandinavian nations, um, they are also can be, and I wouldn't say limited because they can act independently of other nations within the EU, but some of the EU directive can limit where they really want to kind of push miles and miles ahead of the other nations. But yeah, as I said, the UK isn't too far behind in terms of education around kind of reuse, etc. It's just we really need to kind of start actioning this kind of stuff and really trying to kind of bring and trigger the behavior change and making reuse the kind of the norm over single-use packaging, which is difficult, but I think we really believe we do have the kind of solution that can yeah, allow this to happen.
No, definitely. Very interesting to hear about your experience and just sort of your progress so far. So I definitely am interested in what triggered you to enter this issue. Was it any personal experiences? Why is sort of packaging waste something that you're feeling passionate about just generally?
So to give a bit of background, like during my masters and a little bit afterwards, I did a bit of on and off freelance writing for a company called Impactor, who are kind of an environmental news outlet online. And a lot of what I was writing was just basically focused on sustainable developments within the startup sector globally, really. Anything that kind of just caught my eye and I found interesting, I'd write at some points frequent, some points relatively infrequent articles, just on stuff that I kind of found interesting. And there was a couple of startups that really did kind of catch my eye. There was one called WasteLink, who were based in India, who were kind of solving food waste, actual physical food rather than packaging waste, and turning them into kind of nutritious like animal feed. And there's another company that was based in Latvia called Coffee Co, who were turning like kind of coffee grounds into like a range of different kind of items that were useful. And from that point, I just kind of thought it'd be really interesting at some point in my career to potentially work in one area of where, because obviously food and catering is something that's central to everyone's lives. It's no matter where you work, in an office, in a hospital, at a university, you're going to need to eat. And as lovely as the idea of doing meal prep and bringing in your own thing every day is, it's not necessarily the most realistic thing. So it's something that's affect everyone's everyday life. And yeah, I moved back to the UK, saw the opening at Cauli and I thought that could be quite interesting. And now that I've kind of thrown myself in at the deep end, it's something that I think my passion, where initially it was more of an interest rather than a passion, has now developed into definitely a lot more of something that I really do care quite vehemently about.
Yeah, no, definitely. I can see that passion coming through actually. And I think, if you are passionate about something, even if barriers are faced, you will keep pushing through. And that's what comes through. Like you and your team are pushing through. And I'm sure you faced resistance here and there. Tell me a bit more about the solution. So now, I appreciate the issue. Certainly, it is a big issue, and I'll discuss more about sort of the hospital scene in a second. But the solution, particularly when I came across it, I was like, this is so simplistic. Like it makes perfect sense, and it's very user friendly. So I don't know if for our audience, you could probably give a very brief step by step.
Of course, of
Review.
course. So something that we definitely took into consideration, not just for our hospital sites, but definitely something that really applies to hospital sites, is we need something that's convenient, but also commercially viable for both our clients and for consumers, especially when you take hospitals as an example, a very high stress environment. Everyone who's working there is just, I can't even imagine it. So props to you. But people working 12-hour shifts and a lot of very stressed patients and patients' families, etc. So if you're trying to bring in a really kind of complex reuse solution, it's just not really going to work. And at the same time, commercial viability is definitely key for clients in terms of hospitals all operate on relatively tight budgets. But also kind of on the consumer side, our solution is free as long as you return the item that you borrow. But yeah, I'll just delve a little bit more into that. So here at Cauli, we basically provide our clients with everything they need to run their own reuse systems. That's from our reusable cups and reusable boxes for food. The rest of our hardware, which include our automated reverse vending kiosks that we call Cauli kiosks, and our tap and go terminals, as well as all the relevant software required for anyone to track the actual kind of real-time usage stats and the positive environmental impact that they're having. So there are basically two ways that you can borrow a Cauli container. The first is through our online app. Very simple. Each container has an individual QR code. You scan the QR code using the app on your phone, show that the borrow has been successful to the vendor, and then you're on your way. But we also appreciate that some people either don't want to download an app, they might not have a smartphone, or they might be visiting, for example, Adam Brooks on a one-off basis. And that's where our tap and go terminals come in and really have kind of removed that kind of gap in the market per se. With these, they're kind of like little ATM terminals with a QR scanner on the side. You scan the QR of the container, you'd either tap your Apple Pay or payment card for a £1 holding charge. We have to emphasize this money doesn't leave the account, it's just a hold to link that person to that container. And then the borrow process is the exact same. In both cases, you have 7 days to use the container and return it. And you do this to one of our reverse vending machines that you've probably seen dotted around Adam Brooks. These have a big QR scanner on the side and a big kind of depositing like flap. So you scan the QR of the container, the flap will light up indicating the return's ready. You pop your container in and the LED strip around the QR scanner will turn green, indicating a successful return. On the kind of like engineering side of things, obviously, as this is the Clinician's Engineer Hub, we use a machine learning camera inside the kiosk to show that the return's been successful. So it will actually take a few photos of the container being returned inside to actually verify that the return's successful. This is basically just to prevent people from scanning the container and walking off. Some people do think that that does work, but then they find that actually the kiosk is slightly smarter than they think. In both cases, as I said, 7 days to return. If you don't return after 7 days, you are charged £5 per item. However, you then have another 60 days to return the item for a full refund on that £5. The late return charge is really there to incentivize people to bring the items back into circulation. That's why we offer the refund. Any income generated from the late return charge is basically used to replenish stock in that location so they can continue running at full capacity. So yeah, that's kind of a relatively brief run through of our solution and how it works.
No, it's really fantastic, and I like the fact that it's already sort of preempted possible deviations from the pathway, particularly through the camera technology. I think one of the interesting things, so obviously in the clinician engineer space, let's say a clinician has an idea and has assessed the market and realizes that it's a repeated problem through constant observation, let's say. And then there's a sort of rate limiting step. So how do you then hunt out the necessary engineers to do what you would want to do? So say if I wanted to potentially meet someone in machine learning with this camera-based technology, I think one of the issues clinicians face is that we want to do stuff, but then we are struggling to find the engineers to support us. Is there any particular ways or advice that you could offer clinicians generally, or?
From a personal perspective, not so much. I'm obviously more on the kind of business development side, and as amazing as our kind of app and the technology behind the hardware of our solution, I do have to give that credit entirely to our into our product team and a lot to do with our operations team in terms of kind of sourcing new suppliers and all that kind of side of the business. To be honest, I'd probably say the advice for clinicians would be using platforms like this Clinicians Engineer Hub, and I'm sure that I mean, obviously you and your co-founders founded this with the idea that there is a gap in the market. I'm not too sure in terms of this space how much there is cross collaboration between the engineering and clinician sector. I'd probably say using platforms like LinkedIn is definitely one way that's
Okay,
really good
yes.
to kind of connect with like-minded professionals or professionals in different spaces that you're interested in. I think
Mm,
um, yeah, just trying to be quite proactive and actually actively messaging people, because I think you'd be surprised at the amount of people that would be interested to kind of talk about something that's their area of expertise and kind of
yes.
offer yeah, cross collaborative solutions.
No, I think you summed it up very nicely there because actually, even though it's 2025, we are seeing engineering advances all the
Mm,
time, but the actual gap there is, that continuous synergy between the two professionals when it comes to
mm,
solution forming. So yeah, no, glad you support what we do. We certainly support what you
definitely.
do. Um, let's talk a bit more then about the business side, because I think that's quite important for clinicians as well. We don't get much training
Mm,
in medical school around this, but I think the way healthcare is evolving, I certainly know that the generation below me, very keen in startups, very keen in enterprise, very keen in innovation. I think blindly following hospital guidelines kind of frustrates them slightly because they have a broad range of skill set. So let's say they do go through the various steps, they solution form, they develop a product with engineers, and then, like you've done, approach Adam Brooks Hospital or allied NHS trusts. How do you do that? Do you reach out through email, or do you focus purely on introductions through investors? It seems like an area which is sort of unknown to many clinicians, I think.
definitely. I think the first things first you've got to identify is your correct target within an organization. I think if you're trying to be kind of too broad with your outreach and you're not kind of specific and generalized enough, then it can just kind of fall on deaf ears, if you know what I mean. So it obviously completely depends on the area that you've been developing in. For me, for example, ours falls under the. I do actually. I'm quite lucky in terms of I've got a plethora of different people at hospitals that I could speak to that would be interested. But the main people would be obviously people working within catering. This obviously can then vary if there's an in-house caterer or they work with one of the larger kind of contract caterers, because then that kind of opens a completely different kettle of fish. But then, obviously, pretty much every hospital and trust has a dedicated sustainability and ESG team. This might also then be kind of divided into people working within waste management and recycling, which would really be the people that would definitely be kind of on our side and championing these solutions. But then, obviously, professionals in my side that work within kind of heads of facilities, heads of estates, heads of operations, people who really work on kind of the smooth running of how the hospital works on a day-to-day basis. And then you also just have the C-suites, the CEOs, COOs, the really high-level people and the influential decision makers. And yeah, with these people, you do have to be a bit more kind of tailored with your outreach. And it might just be using them to kind of then they kind of point you in the right direction of kind of how to approach that hospital, that specific group of hospitals within a trust as well. So I'd say first things first is really just identifying a target market and doing your research before you actually kind of go out there and start making moves. On the whole, like investor side of things, that isn't my area of expertise. So in terms of advice on that area, I unfortunately wouldn't be able to offer too much. But in terms of outreach within the kind of hospital space, if a clinician partner with an engineer and create a really new kind of cutting edge technology or something they felt could be really useful, just making sure you're identifying the right people within hospitals and trusts to talk to. And then go from there, because people are genuinely helpful. And if you do have a really good product, just speaking to one or two of the right people within one trust can go a long way. Um, I'd probably say the one other really useful thing, especially within the healthcare sector, is attending events and meeting people face to face. I find, especially with hospitals, people are so busy, they're on their feet all day that they might see an email and they might think it's great, but they just don't have enough time to actually reply to it, get around to it. And stuff can all move quite slowly. Whereas if you attend certain events, for example, I attended the Hospitality Catering Association, which was up in Birmingham last month. Really interesting 3 days. We had our solution kind of integrated into the entire event. So people were given our reusable cups, and we had a few of our kiosks dotted around. And yeah, just got kind of speaking to a few people, get a few business cards printed out, give them out, and just allow people to really put a name to a face. Is just what I can say is one of the best ways you can really go to develop a business and get your kind of product out there.
Fantastic. No, it's very interesting. I think, you've touched upon the elements of networking and clearly visibility. So no, this is a really sort of interesting journey. I'm quite interested just to summarize, roughly timelines. So let's say the product has been built, which it has, and I've demoed it and used it myself. From the initial introduction in a hospital setting to okay, let's put this in, the concourse or whichever area. What's the rough timeline for that in terms of sort of NHS processing?
So our kind of broad guideline for implementation is 8 weeks. So this gives enough time, once the contract's signed, it gives us enough time to make sure all the appropriate hardware is in place, deal with any potential kind of IT issues and compliance-based stuff that might pop up, which we have found as an issue, especially more so in universities and offices than hospitals. But it's definitely something that can be a bit of an issue, especially since quite a lot of hospitals do tend to be kind of like blind spots for 5G in a lot of places. So you do really need to kind of have like hardwired internet into a lot of our own hardware. But it also gives a chance for us to really send across the appropriate kind of like marketing collaterals, communicate across any catering teams, and the sustainability team can kind of get kind of a campaign going. Because when it comes to influencing people's behaviors, especially in a hospital environment, communication and timing is absolutely key. If you try and bite off more than you can chew, and if you try and rush it, and if you don't communicate clearly what these changes are going to be, how you're really trying to integrate reuse, what the positive effects of reuse are compared to the single-use alternatives that are currently quite ingrained into the habits of people working there, but also people visiting, people who might be patients there. So the eight weeks can tend to be a relatively conservative estimate, and a lot of the times we do find not rushing it and making sure we just take the appropriate amount of time is the best way of doing things. But just from my personal experience, it's kind of an 8 week period to really consolidate with all the senior leadership members, get a proper marketing campaign going, really clearly communicate across the entire hospital what the change is going to be, and then after those 8 weeks when it's launched, we do try and offer a few like on-site engagement days, depending on how big the client is, just so we can kind of be there and guide people through the initial process, show them that, oh, if you don't want to download an app, it's fine, you can just do this. Here's how you borrow, here's how you return. It is completely free, don't worry, even if you are tapping your card, as long as you return, because that's just the kind of initial fears. And a lot of catering teams can be overworked. You can train them and really be clear on the solution, but sometimes it does help just to have someone from your company with their own feet on the ground for that first couple of days and that initial kind of like a teething period just before it gets really kind of bedded in.
Yeah, it makes sense. I mean, I'm amazed that even if I'm trying to do a very basic research study to get that done in 8 weeks, I don't think I'd be able to achieve it. So, I think what you've emphasized is that it is possible, that things don't have to be long and drawn out. And I think, engagement and relationship forming, very important.
Yeah, definitely.
And really, if you are trying to get products tested, optimized in whatever space within the hospital, I think that's quite crucial. So
Definitely.
thanks so much, Joseph. You've been fantastic. What we'll do is obviously, make this freely available to everyone, and I'll make sure your LinkedIn is also up there so that people can get in contact. And thanks once again, Joseph. Thank you so much.
Brilliant. Thank you for having me, Neil. It's been a pleasure.
Definitely. Thanks. Bye-bye.